So will the COVID-19 epidemic in South Africa impact on our plans and the goal of achieving national health insurance in the next few years? Well, I think what we're seeing in this epidemic are the fault lines between countries that have good universal access to healthcare and countries that don't. And that generally, when healthcare is accessible, countries tend to do better. Fewer deaths, fewer patients with severe disease, and they tend to cope with this epidemic much better. In countries that are dominated by multiple healthcare systems in parallel, they tend to do not so well, the US being a case in point. In South Africa, our healthcare system on the two tiers between the private and public has created essentially two healthcare systems. They're vastly different and they operate in vastly different ways. That is really not tenable because private healthcare is just continue to become more and more expensive and will become impossible to afford for many people. And so we're going to have to look at some way in which we find a mechanism to give realization to the goal of health for all. Essentially, making healthcare available, accessible, and affordable to each person, and that healthcare is available based on need and not ability to pay.